Good morning and welcome to Radio Friends on Wednesday, July the 24th. Now, I want to introduce you to Dr. Farhan Siddiq.
Yes,
correct?
That's correct.
All right.
Correct.
Good to have you here. MU
Thank you.
Healthcare.
Thank you.
And you are a neurosurgeon, correct?
Yes.
You specialize in brain aneurysm.
Yes.
First of all, explain what is a brain aneurysm?
So, brain aneurysm is a disease of the blood vessels of brain, and certain times, or for some reason, there are inherent vascular weaknesses in the blood vessels of individuals, and that can then balloon up into an abnormal structure that we call is an aneurysm, and that wall of that vessel is obviously weak. So the biggest fear is that wall can rupture and bleed and can cause a hemorrhage in the brain.
Can anyone have a brain aneurysm, or are there certain people that are more prone to it?
Well, so it's very interesting. So about 5% of population in U.S. has brain aneurysms. A lot of them go unrecognized and undiagnosed because they actually don't cause any symptoms unless they either bleed or they grow very large in size. Now, there are certain predisposing factors that we know for sure, such as prior risk of or a prior brain hemorrhage or prior brain aneurysm, a family history of brain aneurysm. Smoking is one risk factor that keeps popping up again and again in multiple studies that suggest that people who smoke will have more predisposition to having brain aneurysms. Similarly, high blood pressure has sometimes been associated with an increased risk of brain aneurysms.
So how do you treat it?
So there are several different techniques. So I'm a dual-trained neurosurgeon, so I do open surgeries and endovascular, which is minimally invasive treatments.
When you do the surgery, I mean, you're actually opening up the head and working in the brain area?
Yes. So that was a kind of more gold standard traditional way of treating aneurysms. Of course, it had its own pluses and minuses, but over the past 2 decades, or 2.5 decades more so, the newer minimally invasive techniques have come up, and we have done major strides in terms of brain aneurysm treatment. So nowadays, majority of our difficult aneurysms we're actually treating through the groin approach. We go in through a small blood vessel in the groin and
you go in through the groin?
Yes.
All the way up to the brain?
All the way up to the brain, absolutely.
And there's a little camera on the end of the...
So we see those catheters on a fluoroscope or an X-ray machine, and so the X-ray machine has different kind of capabilities.
So there's not actually a camera on the catheter that you're sending up.
So eventually, I hope that at some point in our life we'll see that happening, but there is a lot of research. But at the moment, we see them under X-ray, and we have some 3D navigation capabilities through the X-ray, and so that's what we use to see these radio-opaque wires and coils to go inside the brain.
That is absolutely amazing.
Yes.
So you're treating a brain aneurysm without doing the
actual surgery.
Surgery. Yep. And the success rate on this is?
Success rates are very high, particularly the newer techniques that have come up, such as flow diversion, and the most latest thing that we really are very excited about, which actually got approved by FDA this year, is web device, which is also a very small, very interesting device that you actually place inside the aneurysm, and it obliterates the aneurysm from within. So that's absolutely the most impressive thing in our armamentarium. And we have actually, in the Central Missouri, we are the first center that has actually started enrolling patients for this new technique and new
I appreciate you sharing this information. We're just about out of time.
Yes.
But in 10 seconds, are there any warning signs that you're going to have a brain aneurysm?
So if anybody develops sudden onset of headache, which is not relieving, unrelenting headache, please call or come to emergency room, because there is a possibility you may have had a brain
if you have unrelenting headache.
Yes.
All right. For more information, Doctor, thank you so much for coming by.
You're welcome.
For more information, you can go to muhealth.org. muhealth.org. Okay, and thank you. It's my pleasure having you here today.
You're welcome.
Okay?
Thank you.
See you tomorrow. Bye-bye.